Welcome. My name is Peter Strong. I am a professional psychotherapist specializing in mindfulness therapy, which is very effective for the treatment of anxiety and depression. I also work with a lot of people who suffer from social anxiety disorder. So if you're interested in online treatment for social anxiety that does not use medications, but that uses mindfulness therapy, then please contact me and ask any questions you may have about this approach. Mindfulness therapy is designed to teach you how to work with the anxiety directly, how to overcome that anxiety, how to break free from the habit that creates anxiety in social situations. And the approach really is a combination of classical mindfulness therapy techniques that I have developed over the years and mindfulness-based exposure therapy. So this is a slightly more refined form of exposure therapy that is made effective by training before you do your exposures. So an exposure is simply going into a social situation that generates anxiety, but doing this in a very strategic way and planning and preparing and training before you undertake that particular exposure. So that's really what makes mindfulness-based exposure therapy different than classical exposure therapy. We train for each exposure event or challenge by meditating on that particular situation. We play it through in the mind and we look for any anxiety that gets triggered as we imagine going into that particular social situation. When we encounter the anxiety, we then meditate on that anxiety using mindfulness. So mindfulness meditation is extremely powerful for working with the mind, with working with emotions and reactive thoughts. Basically, we learn to change the relationship that we have with the anxiety. We change it from an unconscious reactive habit to a conscious relationship that's based on compassion. Essentially, we are helping that anxiety heal, and that's the primary focus of our training, is to heal the anxiety that typically gets triggered out of habit. We work with it using a variety of techniques that I will explain to you and teach you during our online therapy sessions. But basically, we learn to develop compassion for the anxiety itself, seeing it very much the same way we might see a child who is frightened. We learn to embrace that child and develop a conscious and friendly relationship with it, because that is exactly what a child would need to overcome its fear. We need to do that same thing with our own emotions, our own inner fears. We need to develop a strong and non-reactive relationship with that internal fear, and that's based on friendliness and compassion. This is what works. This is what has been tried and tested over and over again. The real problem with social anxiety and other anxiety disorders in general is not only the reactivity that feeds the anxiety, but the reactivity of avoidance and aversion, whereby we try to escape the anxiety, and we do this by trying to escape those social situations. But if you fall into the habit of reacting with avoidance or aversion towards your own fear, you will simply strengthen that fear. So we do not, under any circumstances, cultivate any kind of avoidance, but rather we turn it around and we turn those situations into challenges that we work with using mindfulness as a way of strengthening our ability to overcome that anxiety habit. And this approach works extremely well. If you do this kind of strategic approach to social anxiety, you will see dramatic changes, often within the first 3 or 4 sessions. It's all about changing the habit of reactivity and learning how to work with those habits using mindfulness. If you'd like to learn more about mindfulness-based exposure therapy and mindfulness therapy in general for working with anxiety, then please go to my website and email me with any questions you may have. And when you feel ready, email me to schedule an online therapy session via Skype. All my sessions are via Skype, and they work extremely well. And even after the first session, you'll start to see results when you start applying the mindfulness methods that I will teach you. So please contact me if this interests you and you would like to overcome your social anxiety without resorting to medications. Medications are not a reliable treatment for social anxiety disorder. They only reduce symptoms, but they do not treat the underlying habit, the psychological habit that causes your anxiety. If you want to fully recover and get back to a position of complete confidence again, you must address the underlying psychological habits. So please contact me if this interests you, and we can get started, and you will see for yourself after the first few sessions just how powerful the mindfulness therapy is for anxiety. Thank you.